To now call upon none other than Dr. Ashok Grover, sir. He is the Chairman, Department of Ophthalmology, Sir Gangaram Hospital, and Chairman, Vision Eye Centers, New Delhi, awarded the Padma Shri by the President of India. More than anything, he has been an excellent teacher, a great academician, and he's been a father figure to all of us. He's been a mentor to many, and I'm sure each one of us is looking forward to hearing from him. I think who better than him can talk to us on ophthalmic education in India. How can the generation next help take it in the right direction?
Thank you, Anaga, for those very, very kind words. This is a privilege to be talking to the future leaders of this country who are going to be the educator, who are going to be the teachers, and the future of Indian ophthalmology rests with you, not just ophthalmic education, and that is through you being the educator. So this is going to be like an interaction, and I hope all the LDP trainees are ready to answer the questions. First of all, we must recognize that we have a massive problem of blindness. We don't know the exact numbers. Yes, they may have come down in terms of prevalence rates. We don't actually know the number of ophthalmologists in this country, but we do know that it is important to have well-trained professionals in adequate numbers to carry out the services that we want to do. And of course, the inequity in the distribution remains a major problem. So this is an old data because we don't have a new data. India, one ophthalmologist for 85,714 people versus 15,800 in US. And ophthalmologist to doctors ratio. So one of all 75 doctors becomes an ophthalmologist. We need to have good data. You know, the figures were 12,000 in government for a long time. Now some people have started writing the figures as 25,000 ophthalmologists in the country, but we are more than 26,000 AIOS members, and at least half the ophthalmologists in this country are not members of AIOS. So the figures are somewhere hugely lacking. So is the residency training in India ready to take on the task of providing the required quality manpower to meet our challenges? Let's look at what kind of training we have, what are the numbers, and what is the quality. So updated on 24th November, medical colleges 706, MBBS seats 108,000, 109,000, this many number of government, private colleges, and so on and so forth. Available seats in residency programs, I once in 2012 went through all the websites of MCI, NB, and calculated, it came out to 1,200 when the government said the target is 1,200 after 5 years or something like that. So this was a data in 2011, 1,285 seats, must have doubled now, but no fresh data available. So now let's look at the quality of our training, which is the big question. So I would like everybody to answer, not just the LDP trainees. How many of you feel that the residency program that you had prepared you well for your practice of ophthalmology in the real world? So when you came out as a resident, how confident were you of doing your work? Yes? How many? So there is a good 15, 20 people who were very happy with their residency program. And how many who were not? So I think the not wins. There are many more. So this is what I wrote in an editorial in 2004. The standards across the country are extremely variable, varying from sublime to ridiculous. So there are those who have received excellent training, but there are those who have not received a training worth their salt. So we have programs which are one of the best in the world. There's no question about them. We have a superb structure, but do we have the foundation? So this was the survey I am talking about when I was the chairman ARC in 2001, when we started many of the things that now ARC does. That was the first time it was called ARC from DASR Fund Committee. So it was converted into Academic and Research Committee. And we realized that there was shortage not just of equipment, shortage of faculty, specialty clinics were hardly existent, and faculty was busy due to so many other things, and many of those facts still remain true. This survey by Murthy in 2005 said that academically there were very few journals and there were less than 5 international publications in 92% of the institutions. So did the interventions, there were some interventions that were carried out, did they help in improving the standards? So this was a study by Ravi Thomas and his team. They studied the standards of residency training 8 years apart in the same institution after providing medical instrumentation and training, and they found there had been no significant improvement. So it's not just the equipment, it's not just the resources, it's a lot more motivation, a lot more human inner drive that is needed. So there were a lot of other surveys, Gogate et al., Ajay et al., who said that there is a big gap of what the residents expect and what they are getting. So now let's look at the surgical part of it. How many of you felt that your hands-on exposure for surgery was adequate? Now there are laid down standards in terms of numbers by US, we also did that as a part of the national curriculum where we have defined each number of surgery, and we collected the data on behalf of Ophthalmology Foundation, which is now the education wing, which was earlier in ICO, now functioning separately, and we collected data from world over. There are figures, but it is the satisfaction that you have which matters. How many of you felt satisfied with your surgical exposure at the end of your training in terms of hands-on training? Yes. Again, a good number, about 15 people, yes. And no, again, hands down, no wins. So that's a major point of dissatisfaction. This study, again from South India in 2015, said that nearly half had no wet lab training. More than 50% residents had not done ECC, phacoemulsification, so on and so forth. 40% residents were dissatisfied with their surgical training. Now, this, not many of you, I mean, the recent ones may not be able to answer, but there are many experienced hands. How many of you feel that there has been an improvement over a decade? And it has been a really monumental one. Okay, so there is a, and how many of you feel that it is not improving? So there are still a significant number of people, maybe about 10 versus 20, who feel that it is not showing an improvement. So there have been a lot of number of initiatives. This was the teaching program in all zones which we started during my presidency in 2011. But there are so many other programs now which are tuned to the training of PGs. And iFocus is one of them, Santosha's program and many others, which I think have at least made the awareness of every person who's in any medical college about how the teaching should be. And what is it to aspire to. The teachers also know that there is a higher standard to be aspired to, which has made a difference. But then there are studies which show that there is a difference, but there still remain a number of shortcomings. This study in 2018 by Biswas et al. Showed that 21st century trained ophthalmologists still lack a lot in India. So we need to do a lot of things. Improve all that we said was short, but an up-to-date and responsive curriculum tailored to national needs was a very important need. So this is where we would like the new leaders, the new generation to come up. You are the future of Indian ophthalmology and the next generation teachers. So what is the structure available to you for you to do? What can you do? How can you act? And what can you do? I think there are a couple of things that I'll outline, and then we will talk about what we have now. So one is that I feel the basis of quality residency training is existence of good subspecialty services, and therefore subspecialty teaching, which can only orient you to become good trainers for the residency program to practice evidence-based medicine. And Now we have a model where we have a national residency and a national subspecialty curriculum, which you must try and bring about, implement it. So let's see what happened. So I wrote this editorial in 2008. We said we are lacking so many places. And then in 2011, we could do a national workshop for developing a curriculum for ophthalmology residency training. And in 2016 and 2022, we could develop subspecialty curricula. So this was a consensus document where we involved all the major colleges, all the major institutions of the country, and it was sent to all the faculty, all the residents, and took their feedback. And this we published as the national curriculum in 2018 when Santosh was the editor, and these were the subspecialty curricula that we devised, listing out all aspects of subspecialty training as well. So curriculum is not just, and what Oxford Dictionary says, the subjects included, but it is a planned educational experience, and this is what the national curriculum has tried to do, which has been vetted by a number of experts all over the country. So it has identified all the core competencies that are needed, what are the requirements of teaching faculty, infrastructure, bed strength, faculty requirements, these have all been defined. Curriculum content has been laid down over several hundred pages. Teaching learning methods are outlined. Minimum requirements of diagnostic and therapeutic procedures have been defined individually, that each surgery, this much the resident should do at the end of his training, these diagnostic procedures, these numbers they should do, and the assessment tools have all been identified in this. And core competencies, patient care, knowledge, practice, evidence-based learning, communication skills, professionalism, system-based practice, practice management, hospital management, financial management, all these have been laid down. We must remember what John Davies said, if we teach today's students as we taught yesterday's, we rob them of tomorrow. So remember to update your teaching skills. So we laid down all this basic investigation numbers, number of cataract surgeries needed, educational resources, structure for assessment. Assessment tools were all available from ICU. We Indianized them, modified them to make them useful. But the crux remains whether you will implement it or not. It will need to be re-evaluated and revised from time to time. But please do not let it happen to your students what you feel happened to you. You were dissatisfied with your training. Ensure adequate clinical exposure, clinical teaching to the generation next, and ensure adequate surgical exposure. Please do that. If you do that, you would have done a great service to Indian ophthalmology and Indian evidence-based medicine. Ensure that you are the real torchbearers of the generation that follows. Remember, it's not just what you learn in the medical college, but train them to be learners all their lives, because that is what is going to make them real good ophthalmologists. So knowledge today is available to you on your fingertips, Google and then AI. So knowledge is not important. How you train them to act, skills that you impart, the thought processes that you impart is important. Learning facts is not important. Education is what survives when what you learned has been forgotten. I'm forgetting the time bells. So wisdom is not what you learn in school, but you have to make a conscious effort to acquire it, and what survives from your learning process. Remember these. But as was stressed earlier, make sure you become a good human being. Without that, any wisdom, any education is not worthwhile. Thank you. Thank you very much. Sorry for being
Well,
late.
thank you, Dr. Grover. An excellent talk as always. And if I have to describe this gentleman in 4 words, it's going to be a good administrator, a successful leader, a academician par excellence, and a very good surgeon. Thank you so much, sir.
Thank you so much.